Hello friends. So this is lecture number 5 of Healthcare of Community series, and today we are going to learn about healthcare delivery system in India. So let's get started. For patient care, healthcare system is broadly divided into 3 levels. First is public healthcare sector, second is private healthcare sector, and third is voluntary health agencies. So the public healthcare sector in India categorizes different level of healthcare services as primary healthcare, secondary healthcare, tertiary healthcare, health insurance schemes and other agencies. So first we will see what is primary healthcare. So primary healthcare is the first level of contact of individuals, the family and community with the national health system, where the primary healthcare, also called as the essential healthcare, is provided. As a level of care, it is close to the people where most of their health problems can be dealt with and resolved. Healthcare will work best when it is designed to match the specific needs and available resources of a particular area. The primary healthcare is provided by the complex of primary health centers and their subcenters and through the agencies of multipurpose worker, ANM, ASHA, Anganwadi worker, village health guides and trained DICE. Beside providing primary healthcare, the village health team bridges the cultural and communication gap between the rural and the organized health sector. I have made a video on PHC, ASHA and Anganwadi. The link is given in the description below. Do check it out. The next higher level of care is the secondary healthcare level. At this level, more complex problems are dealt with. In India, this kind of care is generally provided in district hospitals, community health centers, which also serve as the first referral level. The next is tertiary care level. The tertiary level is a more specialized level than the secondary care level, and it requires specific facilities and attention of highly specialized health workers. This care is provided by the regional or the central institutions like medical college hospitals, All India institutes, regional hospitals, specialized hospitals and other apex institutions. A fundamental and necessary function of healthcare system is to provide a sound referral system. Next is health insurance scheme like ESIS, that is Employees State Insurance Scheme and their hospital, CGHS, Central Government Health Scheme and their hospital, Ayushman Bharat, Rashtriya Swasthya Bima Yojana. There are other agencies as well like Railway Hospital, Defense Hospitals. The next is private healthcare sector, which consists of dispensaries of general practitioner. These are small clinics run by general doctor. They offer basic consultation, treatment for common illnesses and prescription. Second is standalone consultation by specialized doctor. These are individual specialist doctor like cardiologist or dermatologist, and they provide consultation in their private clinic, patient visit for expert opinion, diagnosis and treatment. The third is nursing home. These are small scale hospital with inpatient facilities which provide medical care, minor surgeries and post-operative care. Fourth is private hospital. These are large, well-equipped hospital with advanced medical technology, provide specialized treatment, surgeries, emergency care and multi-speciality services. Fifth is polyclinic, centers where multiple doctors from different specialities they work together. Patient can consult different specialists under one roof without visiting multiple locations. Next is voluntary health agencies. There are several voluntary health agencies that complement or supplement the work of government in the field of health. Example is UNICEF, United Nations International Children Emergency Fund, CARE Foundation, CRY Foundation and Ford Foundation. In India, there are several indigenous systems of medicine like Ayurveda, Siddha, Unani and homeopathy. So with this, we have come to an end of this lecture. If you found this video helpful, like the video, share it with others and subscribe for more.